Support for Radio Friends comes from Rotary Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact Rotary Financial, a community-based investment counseling firm since 1966. Learn more at lebrunery.com or by calling 573-449-5313. Good morning and welcome to Radio Friends on Monday, July the 1st. We're going to talk about organ donations today. Now, April was National Organ Donation Awareness Month. This is July, but Joe Weston, I'm going to introduce you first. You had a perfect line for that, right?
Well, I forgot, first of all, to schedule us for April, so thank you for the opportunity now. But organ donation knows no season.
That's right.
Organ transplantation knows no season. People are sick all the time.
Right.
The waiting list is huge, so there's never a wrong time to talk about it.
Now, the reason you're here today, your organization is?
My specific organization is Columbia South Rotary Club.
Yeah.
But with all the other Rotary clubs in Columbia, we've organized an initiative called Rotary for Life.
And you brought a special guest along.
Brought a special guest, Dr. Mark Wakefield, who is a urologist and transplantation surgeon at University Hospital.
Yeah. Now, Dr. Wakefield, we were talking before we went on about the really important need of organ donation. People to sign their driver's license and donate whenever their passing occurs. How many people are waiting for organ donations right now?
In the United States, there's more than 120,000 people waiting for organ donation.
How many of those people will actually receive the gift of life?
Well, last year was a record year, and about 38,000 people received a life-saving or life-improving organ transplant.
What happens to the rest?
Well, the fortunate are maintained waiting on the list, waiting for a good match, waiting for their turn to receive an organ. But some patients will become too sick to receive an organ transplant or unfortunately will die while waiting.
The other topic that we were discussing was the fact that you don't have to die to make a donation of an organ. If you are a match for someone and you are willing to give up a part of yourself so that someone else can live, you're able to do that, correct?
That's correct. The living donation is about a third of the organ donors in the United States, but there's very limited circumstances when how that can happen. The donor has to be very healthy, has to be an appropriate match, and has to go through extensive testing to be eligible to be a safe and effective living donor.
What organ can a living donor give?
So the vast majority of living donors are kidney donors. We're blessed with 2 kidneys and usually only need 1. In some circumstances, it's possible to do a partial living donation for liver transplantation, and in rare cases, lung transplantation can be done in that circumstance.
So we could live with 1 lung if need
Correct.
be. We can live with 1 kidney if need be. And what happens if you take part of the liver? Does the liver regenerate itself?
It does have the ability to regenerate some, but fortunately there's some extra capacity for the liver. And if the anatomy is favorable and the size matches are good, it is possible to do a living liver donation.
What do you say to people, perhaps someone is listening or watching today, that is on the waiting list for an organ? What do you say to them?
Well, for kidney recipients, for example, the wait can be very long. In mid-Missouri, we're fortunate. We have generous citizens, and the wait list is manageable. But the average person is going to wait 3 to 4 years. So I really tell them to be prepared but patient and to take good care of their health. Try to improve their health, which is very difficult if you're on dialysis, while you're waiting for that gift of life.
Yeah. And I guess the mental state that you have makes a great deal of difference, doesn't it?
Well, the patients who seem to do the best have an optimistic frame of mind, a high degree of motivation to recover. It's routine surgery, but it's miraculous surgery. The medications
You call that routine surgery?
Well, the first successful kidney transplant was done more than 15 years ago, and the fundamental technique hasn't changed that much. What has changed is the sickness of the patients in whom we are believe that transplant is a benefit over other treatment options. And so the patients tend to be older, tend to be sicker than 25 years ago. And the technological aspects of the surgery is miraculous, but kind of routine. Now, the recovery, which depends a lot on the patient, overcoming complications, adapting to new medications, really benefits from a positive attitude and a lot of resilience and reserve.
That's true with almost anything, isn't it?
That is
true. A positive
true.
attitude makes all the difference in the world. Joe, you've been sitting over here, and we've kind of ignored you. But what do you want to add to this?
Well, our whole purpose with this Rotary for Life program, and Dr. Wakefield has been so great to share his time making presentations with us, is to encourage people to sign up on the organ donation registry. There are many more people on the sign-up registry than the waiting list, than the need. But you can't guarantee that because you sign up, you're going to pass and you're going to be approved and your organs are going to be okay to be transplanted. So we really need many, many more so that your organs can be judged worthy.
Now, as long as you sign the back of your driver's license and you've got that little heart symbol on your driver's license, does that count for signing up on the organ registry?
Well, it does in Missouri, and I have to ask Dr. Wakefield, does that put us on the national registry also?
So there is some communication among states. Missouri recognized this as a first-person authorization. That means you're telling the world that I want to be an organ donor.
As long as you have that
Yes.
symbol on your driver's license, if whenever you pass on, they know that you want to be an organ donor.
That's correct. Now, I also advise that you tell your family and friends, because sometimes there's confusion. Make it clear what your wishes are. Have a living will, sign your donor card, be part of the registry. Remove any doubt about it.
Right. I just cannot imagine why anyone would not sign that registry and have it on their driver's license, because once you've gone, if you can pass that gift of life on to someone else, what a wonderful gift.
Oh, it's free.
Yes,
it
it's
doesn't
free.
hurt.
It's free. Right.
Doesn't hurt a bit,
No.
and you can save
We're out
somebody's
of time.
life.
How can people get in touch with you?
Rotary South website, ColumbiaSouthRotary.com, and this was initiated, we always want to say, by our charter president, the late Tom Thomas, who appeared here with us, had a heart transplant.
Thank you very much, Joe and Dr. Wakefield, for coming by.
Thank you so much.
Sign your
Thank you.
donor card, okay? We're out of time. Bye-bye.